Once again, beautiful people, it's a tooth doctor Maureen Mora here. Welcome back again to my YouTube channel. All we do is talk matters oral health, and it's simply because I do believe everybody is entitled to good oral health status. And in today's video, I want us to talk about a topic that has been requested by one of you in the comment section in one of the previous videos that I have done, and that is bad breath. So, if you're out there struggling with bad breath, or you happen to know about someone who is battling bad breath, then you can honestly agree with me that this condition is such a confidence killer on its own level. And that's why I want us to talk about it today. And I'll be giving you a few tips on how you go about it. So, bad breath, in our technical clinical setup, we normally call it halitosis, is that persistent and unpleasant odor that usually comes from your mouth. At some point, it can become chronic to an extent that even if you do that proper toothbrushing, you use your mouthwash, you do your regular flossing, it may not help at all. And ideally, for bad breath halitosis, we normally classify it into two. So we have the true genuine halitosis and the false halitosis, also known as halitophobia. So in the situation of true genuine halitosis, the causes can be one, poor oral hygiene, whereby you consume your food and you don't clean well, the food is gonna pack on your, it is gonna stay on your teeth, and the bacteria are going to do a lot of decomposition, and after that, if the cleaning again is not done, the end result is going to be that not so good breath that will be coming from your mouth. So another cause can be dry mouth, especially from those people who are mouth breathers, maybe because their nasal breathing is limited in one way or another, or if they're on some medication, which for some reasons ends up drying the saliva in your mouth, causing the bacteria to multiply and become more than the required amount in your mouth. Another reason, another cause of bad breath can be diet. So if you consume a lot of garlic foods with a lot of garlic, onions, especially the fresh ones, some foods that have improper digestion, they can lead to the gastric reflux. Hence, you end up having that foul smell in your mouth. Another cause is smoking, whose permanent solution is just quitting. And we also have some systemic conditions. For example, we have the throat infection, we have the sinus infection, we have the gastrointestinal infections, we have the liver diseases, we have kidney diseases, even for those patients with diabetic as well. So, how are you going to tell that you have bad breath? I normally say, for if you are married, you can ask your partner who, if they notice any unusual smell that is usually coming from your mouth, or someone who's close to you and you are comfortable inquiring that from them. Or you can take the dental floss, try to floss in between your teeth, and then put the piece of floss near your nose. If at all you are having a bad breath, then definitely you're going to notice that. The management of halitosis, bad breath. Number one, brush your teeth 2 times daily. Normal brushing, if done well, removes about 99% of the food debris, all the tiny speckles that usually attach to your tooth. Once you do the proper teeth cleaning, you can complement that with flossing at least once daily to get rid of the dirt that usually trapped in between your teeth. Number two, brush your tongue. 99% of the bacteria that cause bad breath are on your tongue. You can use tongue scrapers as possible. because some people tend to say that if they brush their tongue, they get the gum reflex. If you can't be in a position to get the tongue scraper, then just use your brush. Start pole pole, unaanza na hii side ya mbele ya ulimi, you increase that going backwards, because honestly, you have to clean your tongue, you have no option about that. Another thing, drink a lot of water. Also, avoid garlic or onions, ama tuseme tu kachumbari, especially if you are going on a one-on-one meeting with someone, ama if you have a date, because these food components tends to cause some temporary halitosis within your oral environment. Another thing, avoid mints, because mints in many circumstances they tend to cover up, ama they tend to mask the bad breath. Instead of that, I can advise you use the sugar-free gums, especially those that do contain xylitol, because this is a special component when it comes to doing away with bad breath. Also, if you have dentures ama any other removable appliance in your mouth, tafadhali make an effort of cleaning those appliances, because if you don't remove and clean them, food is gonna pack inside there, and it is going to aggravate the bad breath, ama even if you do good cleaning, there's already food trapped somewhere within your oral environment as well. Another thing is to avoid dry mouth by trying to consume enough water as much as you can. Also, make an effort of ensuring that you regularly try to change your toothbrush. Once you've done all that, the ultimate thing to do is make a point to visit your dental practitioner, who is going to either do some deep cleaning or advice in whichever way possible, depending on how your condition is presenting. And after doing the deep cleaning and you have maintained all these things that I've talked about, and the bad breath is still persistent, then there's a possibility that your dentist is going to refer to you to a physician, a gastroenterologist, who is going to now find deeper if there are some systemic conditions like the ones mentioned earlier, which are aggravating the bad breath. And to wind up on this topic, most people don't know that they have bad breath or halitosis. And simply because some of them, the smell becomes part of them. So, and as mentioned earlier, there are so many causes of bad breath. So before you start off bashing someone or making them feel bad about their condition, try to understand that, and even much better, you can ask them to visit a dental practitioner who's going to give them more assistance. So guys, if you do find this video helpful, feel free to share to your friends. You might end up helping someone out there. Remember, we need to form a good oral health squad right here on this channel. Till next time, bye.